Hi, Tiana here from Mind Body Movement Center. I, not in a million years, thought that in my PT career I would be speaking about spirituality and religion. And I did that, yes, a couple weeks ago, and I spoke to a group of dentists in Berkeley. And a little bit hesitant about bringing that topic up, but I felt that it could be integrated into not only their patient care, but also their own self-care and their outlook on their lives and their jobs for the betterment of their experience. So I thought that spirituality would be a good topic to bring in because it is a way that folks are studying, how we cope with pain, disease, injury, and how we find meaning in life and optimism. And that is a lot that I work with when I'm working with somebody who's had pain for a long time. So losing a sense of self, meaning they can't do their job anymore, they can't be in relationship with their spouse anymore, or they're not social anymore because they can't go out without having pain, or thinking about what they can do, feeling limited in life, just in general. So there are some. So if you think that you're not spiritual, you might think again when you hear some of these definitions, and I'm going to read them off of my presentation. And these were from a paper by Amy Walkholtz from 2011 talking about this topic. And some definitions that came up: definition of spirituality, the basic human experience of seeking understanding, meaning, strength, and transcendence of a desire to go beyond, basically to look beyond yourself for meaning in life. Defining spirituality, coping strategies as more than religious because they involve relationship with self, others, God, or nature. And while illness takes away your self-control, spiritual coping strategies enhance self-empowerment. So last definition of spirituality: an individual and open approach in the search for meaning and purpose in life, a search for transcendental truth, which may include a sense of connectedness with others, nature, and or the divine. So the ways that we seek a connection beyond ourselves with the environment around us, nature, where our food comes from, the animals that we interact with, the people that we interact with, and that we're all somehow connected, and that brings us a little bit closer and helps us to find purpose. So you might find people engaging in service, and that's something that I have recommended to patients when I see that maybe they're lonely or they're lost from their community, is to find some way of serving others so that they connect in that way. So anyhow, I just wanted to touch on that because I think it is important, and I think if you begin to think about that, we can all say that we're perhaps a little bit spiritual in practice, because I think we all kind of have a sense of wanting to find our purpose in life, finding connectedness to others. All right, all for now. See you next time.